had a scan or might have had even surgery to do something, and it's not had the benefit. These knee arthroscopies that tend not to do too much, and if your rehab's not correct afterwards anyway, then you're in a similar position. It may not actually be the cause of the pain, and the reason it's there in the first place could have been solved or addressed by finding out where your weaknesses or imbalances lay in the first place anyway.
Hello and welcome, and on this episode we're going to speak to Joby from Reboot Injury Clinic about injuries, and he's going to introduce himself right now.
Morning, I'm Joby Wilson. I run our Banbury-based injury clinic, and I also lecture at the University of Coventry. So I'm a lecturer in sports therapy there, and what we do both at the university and in the clinic is focus predominantly on rehabilitation and the exercise benefits for pain and for injuries.
So just to explain to everybody, I hold Joby in extremely high regards. He's fixed my injuries in the past, he's fixed various clients' injuries, he's fixed other people that I recommended to him, and if he said to me flicking my bicep like this for 10 minutes every single day for 2 weeks was going to fix the tear in my hamstring, then I'll probably believe him and I'll probably do it. Talk to you then about injuries that occur in people that start new activities for the first time. If you've never been running before, but because we're in lockdown, there's not much else we can do. A lot of people have taken up running, so that's one example, maybe weight training, whatever. So injuries that occur in new activities.
No pressure there then, so you're throwing me straight in at the deep end. The flicking the bicep to fix your hamstring isn't something I recommend, but I'll have a little look into it and see if it will be worthwhile. In particular, the majority of these injuries that occur when people initially start a new activity is a result of how quickly they initiate or start to incorporate those new activities. Everybody's now gone from 0 to 100 on their running, and there's a tendency to start at what people see as the minimum dosage, which is going to be multiple runs per week. It's going to be a set distance, and often people target that 5K as their starting point, when realistically, to dive into such a high demand activity like running is. And the same applies to people's gym activities as well. But if you look at the requirements for running, we need a significant amount of strength in both the hips and the lower limbs. We need a lot of mobility in the ankle especially. And often if people have had previous injuries, or if they've not necessarily done a lot of strength training before, or haven't even done a lot of running before, then they haven't got the ability to cope with the demands of running. Now, whenever an injury occurs, it's an inability of the tissue that's become damaged or the structure that's become injured to cope with the demands that we're placing on it. It's often a load tolerance issue. Now, that load tolerance could refer to even something like a fracture. If a fracture occurs, that bone wasn't able to sustain the tolerance to the load that was being applied to it, and that could have been a baseball bat to the shin, or it could just be the repetitive overload of doing something again and again and again. With our tendon issues, which often occur with running, things like your Achilles tendinopathies, you may have heard it as tendinitis, that'll often be because people ramp up too quickly and are increasing the total volume or the accumulative load that's being placed on that tissue. And then it doesn't have the sufficient time and the sufficient strength to heal and actually allow it to repair itself ready for the next activity. So in monitoring people's gradual progression, we can often see that they're able to avoid those injuries. So if you're jumping into a new activity and it's not necessarily being guided by someone who can take you through those steps, that's what will often occur, which is where a personal trainer can be really useful in almost holding you back initially and ensuring you've met the demands to cope with what you're going to be required to do at a later stage. So for example, if someone's going to be squatting for the first time, we can look at you and see whether or not you've got the capability to actually complete that activity. If you were to drop into a squat, you need significant hip mobility, you're going to need a lot of ankle mobility and some mobility in the upper part of the back to maintain that upright position when you're descending into that squat. And if you can't meet those prerequisites, you're not ready to go into those activities. So with people who we see in the clinic, your readiness to go into those activities, and we ensure that people can earn the right to go into that. If you can't do this, then you haven't earned the right to do that. If you can't complete this exercise to maintain your ankle mobility or increase your ankle mobility, you haven't earned the right to squat. if you haven't got sufficient strength in the lower limb, then you haven't earned the right to run. And that's what's often skipped over when people initiate their activities. If we can build some sort of baseline level of strength and some preparedness for the activities they're going to be completing, then it often decreases their injury risk and ensures that they can gradually progress. And then we also have to track and monitor how quickly people are increasing their distance or their load on strength training activities. So for running in particular, we look for no more than about a 10% increase per week. And that doesn't necessarily mean per run. It could be that you're running 3 or 4 times a week, but in terms of the distance that we're looking at, if you were to increase more than that per week, we increase our chance or our risk of injury as a result of that sudden change in the load or the demand that we're placing on the body. And we need that time to get used to that new training load or that demand and allow ourselves to recover and repair the tissues to be ready for our next run. The same applies to our strength training as well. Bench pressing type activities often where they jump first into their resistance training exercise. And if you've not completed that activity before, you've probably noticed the first time you ever did a bench press, you've got these crazy kind of wobbly arms because we're not able to recruit the right muscles to complete that activity as it should be. We almost need to learn how that movement takes place first. And a lot of your initial training shouldn't be about increasing the weight to a point where you feel that you're lifting a heavy load, but it's about learning to complete the activity and getting the movement pattern correct first. And that's where a lot of injuries can be avoided and we can stay away from causing any of these overload issues or potentially a more traumatic injury.
That's massively interesting. I'm not a runner, as you know, mainly because I just hate running. With the weight training side of things, the wobbly arms with the bench press type movements, see that in clients for the first time all the time. So I totally get it. I'm with you on that. And the squatting again. I think squatting, especially with home workouts as well. Squatting is like in every single home workout, whether it's a free Google one or whatever it is. Squatting is in all of them, and the amount of people that can't squat properly is quite amazing, really, because as you say, like so many things come into place. It's actually a more complicated movement than people realise with the mobility in the ankles, the hips, upper back, everything else, like you said. How do you manage those injuries? Obviously, you talked about not going in too deep in the first place, but if you have gone in too deep, how do you then manage it? And obviously, that's quite a broad question. It kind of depends on the individual, but a summary point of view on the whole, how do you manage like existing injuries from running too much?
A really good point. The squatting does come into so many different workouts and so many different training plans that people actually complete, and you'll find that people haven't done a lot before they've been told to squat, and the squat isn't really coached in a lot of those programs as well. And it's such an essential movement, not just for your workout or for your training, but as we age, we need that strength to even bend down and sit on a chair or sit on the loo. So it's something we need to get right and something that's going to be essential as you progress into your later life as well. As for common injuries, it varies massively and it's completely different between our runners and gym goers. If we start with the gym goers, the most common thing we probably see is a range of different shoulder issues. The most common, probably, with the fascination with the bench press is a long-headed biceps tendinopathy, which is this pain that people feel across the front of the shoulder here. And when people often come in, they think it's a rotator cuff issue, and it has a relevance to the rotator cuff, but it's not necessarily a cuff issue itself. It tends to come on as a result, again, of overload and overuse. But in things like a bench press, your bicep shouldn't be involved, and there's a reason it starts to get involved with it as well. So it can be technique related. So again, what we mentioned at the beginning, if people ramp up too quickly and load, they tend to modify their technique in order to try and be able to press more weight. And the goal is always seemingly the weight, or increasing the load, or increasing the number of reps you're doing, something along those lines, then leads to the progression of the injury. And what it often comes down to is there being a lack of strength and support in the mid part of the back. Everybody loves to train the things you can see. So everyone likes to train quads, abs, chest, the things at the front. And what it results in is this imbalance between the muscles that are more important in the other side of the body. But a lot of the issue comes down to when people train back, it's a number of different pulling exercises, the majority of which focus on your lats. Now, if we've got our pecs that are being trained, it's going to cause the shoulders to come in. And your lats, although they start on the back, they come through and insert to the front of the shoulder, and they're going to cause the arm to rotate inwards. So if we train chest and then lats, we're just forcing the shoulders to come in more and more and more to the point where they begin to go into this protracted, rounded position. Now, that's not necessarily an issue. You'll see a number of athletes who have that shoulder position, but it's the stability in that position that can cause the issues. The muscles that then stabilize our shoulder blade and maintain our shoulder blade stability are going to be providing a base for a rotator cuff to work off. And if the cuff's not providing that strength to support the shoulder, then your bicep tends to take over and we end up with that pain at the front. That, in combination with a technique where we're pressing with the arm higher, rolls the shoulder forwards more and puts a lot of stress across the front of the shoulder. So it might feel like in your pressing, your delts are always working and they're where you feel the majority of the pain or the majority of the soreness in the days following, as opposed to getting the DOMs into the pec itself. Often that's just a case of adjusting your technique and dropping the elbows down to a better position. And avoid just chasing the load and chasing the numbers in those initial stages. And we'll look to gradually progress them back to that. And I'm not saying stop training completely, because there's a number of things when you have got those shoulder issues that we can continue to train around. And generally, if something's not painful, we can continue to do it. So we might take them completely off their bench pressing or their chest pressing if it's that type of shoulder issue. We may regress them to a floor press. Now, the benefits of a floor press is when my arm comes back, it doesn't pass to this point where I'm then going to get that stress across the front of the shoulder. The elbow hits the floor and it stops with the elbow bent to about 90 degrees, which then doesn't allow the shoulders to go into the position where it's taking the brunt of the force across the front of it. We'll also look at modifying their technique and trying to get the elbows to drop down almost at about 45 degrees to the body. So if you're dumbbell pressing, we tend to rotate the dumbbells to about 45 degrees to press. Whereas if we're chest pressing, it's focusing on the bar path actually arcing down to come lower onto the sternum, that kind of bony breastplate. If we can modify that, it takes the stress off the shoulders, it loads more into the chest anyway. So for those who are looking to increase the pec strength in particular, or increase the size, then it's actually going to be a more beneficial technique. The pec attaches to the sternum, but it also attaches to our collarbone. So if we can arc the bar, then it's going to get a little bit more of these fibres that attach to the collarbone, as well as that pulling movement in that gets the fibres attaching to the sternum. So it's an improvement in technique, it's going to have an improvement in the benefit of the pressing anyway, and it's going to reduce the injury risk. A lot of the other work that we'll do will then look at strengthening the mid part of the back in order to provide a decent stable base for the shoulder blade and therefore the rotator cuff to work off, to make sure the shoulder's not taking or the biceps not coming in to assist in that stability of the shoulder. It shouldn't be doing that job, it's only doing that job because it's in a terrible position and it has to take over some of that role, but it's not what its focus should be.
As well, that the presentation is worth 100% of the grade for the 5002 square module, whereas the fiver is going to be worth 50% of.
For runners, onto the next one, for runners, the main thing we see is knee issues. And if you've ever just ramped up your running, you've probably felt it. And it's a number of different knee issues that can come on. We can get patellofemoral pain syndrome, which is just a pain around the front of the kneecap. We can get a runner's knee, which is a pain on the outside of the knee. Or there's also potential issues along the inside of the knee if the knee's collapsing inwards and overloading that medial side. All of which comes down to the ankle and the hip predominantly. So our knee, unfortunately, is just the stupid thing stuck in between an ankle and a hip that aren't doing what they're told or what they should be. So if we look at the ankle first, with somebody who's got these knee issues, it's going to be a case of trying to improve the ankle mobility. Because if they've got that restriction ankle mobility, the knee's not necessarily able to travel straight forwards over the toes, and instead it gets forced inwards. So it hits its furthest point going forwards, and it gets pushed across, usually to that inside. What we should have is sufficient ankle mobility to allow it to travel straight over the second and third toe-ish, And if that's not happening, it finds another way to increase that mobility by rotating inwards. And then we have to have the outside of the hip working harder to pull the knee back across, which can lead to some of our pain on the outside of the knee. If the knees regularly collapse inwards as well, then we could get some of the pain on the inside of the knee. So all of these issues could be due to a lack of ankle mobility. At the foot, we've also got to think about the strength of the arch. Now, if you ever had your gait analysed in a running shop, then they've probably told you that you pronate, which is a good thing. We're meant to. If anyone's ever told you it's an issue, how much your foot pronates, take it with a pinch of salt. It's going to have an impact to some extent on the position of the leg, but you're pronating for a reason. Naturally, when we walk and when we run, our foot lands slightly on the outside in supination, and then as we lower the foot, it rolls into that pronated position and back out. It's a natural response to the foot to being loaded, and it allows us to absorb some force. The important thing isn't necessarily that you are pronating, it's how well we can control that pronation and how much strength we've got in that position. So it might relate to people who've got flat feet, and again, flat feet don't necessarily matter. If somebody has a low arch or a flat foot, it might not be a problem if the strength in the foot and the strength in the calf itself are good and sufficient to control that position of the foot. Don't always stick with that advice that you'll hear from a lot of runners, a lot of running places. The arch is important, but often people cushion the arch and provide some arch support, and what the foot then tends to do is it pushes down harder to try and find that support once it's there. And we need to create that strength in the arch instead of relying on this additional support that's going to be in there. So that's the ankle and the foot. And then the other end is the hip. And the outside of the hip, kind of outside of the glute, is going to be important for controlling the position of the knee and maintaining that straight direction of it. So if the knee is gradually moving inwards and collapsing that way, then there is going to be a greater requirement for the outside of the hip to control that position. So a lot of glute strengthening work, especially lateral work, is going to be essential. And runners go in a straight line most of the time, and a lot of running training is straight line work, which is great, but we still need that strength on the outside of the hips to stabilise our hip height and make sure our knee's travelling in the right direction. The other thing to be aware of is there's been a recent trend with people switching to more barefoot running, and barefoot running can be great for strengthening up the arch of the foot and maintaining some strength in the lower limb. But if you're switching from what was previously a cushion trainer with a big heel wedge, then that heel wedge would have previously provided you with greater ankle mobility. We already said why that's going to be essential. But it also means that if we've got that cushion on the heel, we tend to straighten the leg out further in front of us and strike the heel into the floor first. Now, if we're reaching that heel further out in front, the knee ends up being straight. And if the knee's straight, that force goes straight from the heel to the knee to the hip, and the lower back can take a lot of that force as we flop forwards over it. We have greater forces in braking when we hit the floor and strike with our heel as well. So the idea of barefoot running was that it shifts our foot pressure from the heel to more of the mid part of the foot, and that allows the foot to land further underneath our body. The knee doesn't take the brunt of the force, and we cushion the blow a little bit better. So what we'll initially do with runners as we begin to put them back into running, we'll start off their rehab, we'll get them to the point where they can take some force through that knee again and ensure that it's able to load it well and be stable, having addressed the hip, the knee, and often a lot of hamstring strength as well. But then we can start to reintroduce their running at a rate that's not going to aggravate anything. So we can control how quickly they go back into their running and almost monitor that 10% per week increase in their running loads. In addition to that, we look at increasing their stride frequency. And if we increase the frequency of their stride with no change in their speed, the foot tends to land further underneath the body and we actually decrease the stride length. And if the foot lands further underneath us, we don't heel strike so much. The pressure doesn't go straight through the knee itself, and we're able to support our position better, and there's a reduction in the forces to hit the heel into the ground than if we land on the midfoot. It can often have that improvement for performance as well, as if we land there, the glute can then propel us forwards, as opposed to having this constant stop-start motion and that sinking and dissipation of our force when we come down. So by managing those knee issues, you can actually improve your running performance, becoming a more efficient runner, increasing those running times as well, and have a benefit for reducing the likelihood of any of these knee, hip, ankle, lower back type issues that people often get from running.
Okay, fascinating, absolutely fascinating stuff. The shoulder related injuries and niggles related to weightlifting, 100% agree. I've had them in the past as well. The running stuff, like I find that most people I speak to, clients that are runners, I know a few that might watch this and find this helpful, is a lot of people will go running and they will say, they'll just blame it on stuff they don't really understand. So they'll say, oh, it really hurts, so I must have shin splints, or I've just got dodgy knees. You've just explained all that technical stuff. You don't just have dodgy knees. Like what I've found amazing over the years from speaking to you especially is that if you have a pain somewhere, 9 times out of 10, where you feel the pain is never the source of the pain. It's always coming from somewhere else. So like you're talking about, like your knee pain and lower back pain is actually coming from hips and calves and things like that. So if you are a runner and you are suffering, or even if you've been weightlifting for 10 years and you've got a dodgy shoulder, somebody like yourself, and you go back to your activity that was giving you jip and you're like, oh my God, I'm so much better and it doesn't hurt, which, you know, for the sake of a bit of rehab is worth its weight in gold, really. Joby, it's been a pleasure. I'm not going to keep you for much longer because I know that you're a very, very busy man. You are still seeing people in lockdown. Just like to add that for anybody watching that has kind of struck a chord. You are still seeing people in your clinic, right? So if you want to just add anything else, otherwise I'll speak to you soon.
Yeah, just to add to that last point, you said about people who have always had dodgy knees and people who say that about themselves when they've been running and things like that. Often they may have a diagnosis as well. They might have had a scan or might have had even surgery to do something, and it's not had the benefit they've suspected to have from the surgery. So they might have had these knee arthroscopies that tend not to do too much, and if your rehab's not correct afterwards anyway, then you're in a similar position. So a lot of the time, even if there is a pathology or if there's something that's appeared on a scan, it may not actually be the cause of the pain, and the reason it's there in the first place could have been solved or addressed by finding out where your weaknesses or imbalances lay in the first place anyway. We've had people who said that they're arthritic in those joints, and if you can have something in place, some strengthening exercises that will offload the joint to some extent or modify your technique, then it can have a benefit for reducing their arthritic pain. And often people are pushed down the route of surgery, which is in the long run going to increase your risk of these inflammatory markers and the arthritic conditions that could occur. So there's a lot you can do before heading down the route of, oh, I need surgery, or I've been told I've got this. The amount of disc issues that people come in, I've got a disc bulge at L4, L5. Disc bulges do heal. They don't stay there forever. And even if that's where the location of the issue supposedly is, often their pain isn't actually there. It's a couple of levels above, it's not at that exact point. And there's a reason that disc bulge happened. You address the cause, then it may result in a resolution of your symptoms anyway. So that's what I have to say on it. We are still treating people in the clinic at the moment. We are absolutely coated in PPE. So you'll see me wearing a lovely apron dress, gloves, face mask. And if you aren't willing to come in due to potentially being high risk, we are offering a virtual service. So we've currently got some virtual clients in Abu Dhabi, Costa Rica, and then we've had a few spread across the country from Aberdeen to South Wales and down to Kent. So we can see you virtually, and we do have the same benefit if we're treating virtually. And then if you're interested in the running side of things, we've also got a running program that's soon to be coming out. We've got a few people trialing it at the moment. We've seen a number of PBs, a reduction in shin splints, as you mentioned, as a result of that. So that's going to be available hopefully in the next couple of weeks if you're interested. Thanks for today. Really enjoyed it.
Mate, I feel like your area it's so massive. We could almost do one of these every week. We won't do that obviously, but I'll definitely get you back in and we'll maybe talk about something more specific. Just as a personal trainer, I have people come to me with like, oh, I've got back pain and stuff like that, and with my limited injury rehab knowledge, which I'm not, but in my profession, quite often I can fix people just through basic stuff and basic understanding. But you're so you're a whole few levels above me, obviously. So like, some people that think they have, like I said, have these dodgy knees and stuff and don't understand, the ones that have gone to see you, I know, have been fixed. So it's brilliant what you're doing. Keep it up. Glad you're still busy through lockdown, and I will speak to you soon.